The provincial government is promising more transparency for victims of criminal wrongdoing in the healthcare system. Today, it introduced a bill that could force governing bodies to hold a public hearing when considering the cancellation of a healthcare professional's license. For more, we're joined by the CBC's Ian Fraze. And Ian, why is the government doing this?
Yeah, Health Minister Uzoma Asseguera has heard enough of these heartbreaking stories where victims are dismayed that regulatory bodies can decide on a medical professional's future behind closed doors. Asseguera promised these changes last year after the Winnipeg Free Press reported that Dr. Arsel Bissonnette, convicted of sexual assault, had his license canceled in private. The government's bill would make similar hearings public. Here's Asseguera.
We've heard from survivors that transparency helps to rebuild trust. Healthcare providers, doctors across the board have a sacred responsibility to patients, and they have an inherent trust that patients place to them, with them, in receiving care. And when that trust is broken, it's so important that governments, that colleges, that regulatory bodies do their part to restore that trust.
This doesn't mean all hearings where a medical professional could lose their license will be public. This will only happen when a member is convicted of a crime and that offense impacts their suitability to do their job. There are a few exceptions.
Now, meanwhile, 4 government bills were delayed today. Why is that happening, Ian?
The official opposition has the right every spring to delay up to 5 bills until the fall. Here's what the Tories are holding up. Bill 7 lets public entities, if they choose, to only allow unionized workers on infrastructure projects. Bill 16 repeals a PC law to eliminate red tape. The NDP says all that did was create unnecessary work. Bill 21 lowers the compulsory school age from 7 to 6. The PCs want more consultation first on that. And Bill 9, also being delayed, it extends unpaid leave for serious injury or illness from 17 weeks to 27 weeks. Again, the PCs say more discussion is needed. What the PCs are basically doing here is delaying the inevitable. The NDP with a majority government can still pass all these bills. They'll just have to wait till the fall. Brittany.
All right, thanks, Ian. Ian Fraze live in the newsroom this evening.